Good evening. I am Dr. Senthil Kumar, working in Shanti Clinic, Hyderabad as a general physician. I am going to discuss about how dieting will control postprandial blood sugar. In fact, I will used to tell my patients always follow 3D: diet, drill, discipline. Then only comes doctor, then comes drug. So 5D, in which 3D is very important for you patients. That is, if you are going to follow proper diet, even the load of doctor is going to reduce. The drug, the fifth D, that also is going to reduce. So today I will tell how diet is going to affect your postprandial blood sugar. As the name tells, postprandial blood sugar means after eating how much your blood glucose rise. For example, if you are going to eat too much carbohydrates, the main problem with carbohydrates is whenever you are consuming carbohydrates, the blood sugar immediately will rise. That we call it as, for example, we call that as glycemic index. For example, if I am telling, if I am for South Indian, if you are going to eat 5 idli, 6 idli, that is carbohydrate. What happens? Your postprandial blood sugar will shoot up immediately after eating 5 idli. That means glycemic index of idli is too much. So glycemic index is the value, depends on whatever food you take, how much glucose it rises. That is postprandial. Postprandial means after eating. So glycemic index of idli is definitely too much. But we Indians are mostly fond of. North Indians, yeah, that doubt will people will ask. Then is chapati better? Actually, both rice as well as wheat, both have same glycemic index. I already told what is glycemic index. Same thing, if I am eating 2 roti, how much my blood glucose rise, based on that the glycemic index is calculated. So what I want to tell is both rice as well as wheat, both are carbohydrates, both have almost same glycemic index. So here food control is very important, quantity. There is another term called a glycemic load. Glycemic load means overall portion of the plate. Glycemic index is that particular food, whatever it rises the blood sugar. Glycemic load means, for example, if I take one chapati with lot of vegetables, that means even if the chapati is going to raise the blood sugar, that is controlled by the vegetables. Vegetables are very low in glycemic index. So when I combine that plate together, that is called glycemic load. So how much load you take also matters. So whatever I am discussing today is based on diet. So if you are going to follow proper diet, and according to WHO, even our ICMR guidelines, they say our daily intake of food, one day food intake should be 40 to 45% should be carbohydrate, 25% should be protein, 25% should be fat. But actually what we people, not only patients, actually what all people in India used to take is almost 80% to 90% we are taking carbohydrates. That is the big problem. So we have to reduce the carbohydrate intake, increase protein intake. So obviously when you are reducing the carbohydrate intake, the glycemic index is going to reduce. Or what I told, take less carbohydrate with more of fiber content like vegetables, what I told, you can even take protein content. Then postprandial blood glucose will automatically reduce. So that's how the diet is related to postprandial blood glucose. In fact, diet is the main thing. Then only comes drugs. If you are not going to follow proper diet, what doctor will do? Keep on increasing the drugs, oral drugs. At one stage you will end up with insulin. At one stage even insulin may not work if you are going to eat carbohydrate. So basic mantra is reduce the carbohydrate intake, increase the protein intake. And the glycemic load, as I told, the plate should be healthy plate, like more fruits, more vegetables, less carbohydrate. Thank you.